In this segment, let's talk about the chiropractic adjustment. Spinal manipulation has been around for many, many years and is a tool that chiropractors and doctors of osteopathic medicine have employed to adjust and manage the biomechanics of the spine in particular, and sometimes of the extremities. I think that there is good evidence for the value of the chiropractic manipulation or of spinal manipulation in general. We know that there's ample evidence in the literature for lower back pain that spinal manipulation is helpful. So if you were to work with a chiropractic physician and they are managing your case and they are doing a good history and physical and they're integrated with the medical community, the spinal manipulation therapy is something to embrace and to consider a valid treatment option. It may not be particularly helpful in some situations, and that's okay. Not all treatments are. It's generally very safe, and there are very little, if any, side effects of the treatment or risks, and you can certainly discuss those with your chiropractor. Patients come to us as surgeons that have seen a chiropractor all the time, and some of those patients undergo surgery, and then they wonder, should they go back to their chiropractor after surgery? And my general recommendation would be absolutely. If you have a chiropractor that you have a good relationship with and that you trust, you should certainly consider going back to your chiropractor for ongoing management of your spinal care. There's a few reasons for this. Number one, typically if a patient has gone so far as to need to have surgery on their spine, there are underlying biomechanical problems that are still there and still need management and treatment after surgery for the best outcome. Second is that a patient that has had a spinal surgery is at risk of having another spinal surgery, and there may be a benefit in ongoing chiropractic care to prevent future need for surgery. One question that comes up is, if I've had a surgery, can I have a chiropractic or spinal manipulation in the area that I have had surgery? The answer to that question, in my opinion, is generally yes. If you have been released from care for no restrictions and to full activity by your surgeon, then I would say that that would include having a spinal manipulation. A caveat to that is that your chiropractor should know what surgery you've had, what the most latest and current x-rays look like, and should definitely understand the ongoing problems that you are having. The chiropractor is the expert in spinal manipulation, and he or she may choose to alter the treatment strategy in an area around surgery. And that would be something that would be more in their area of expertise than in mine. So I believe that a chiropractor should be involved in your care generally, really along its whole course, and especially in patients that have had surgery as an ongoing management strategy for the best long-term outcomes and prevention possibly of additional surgery.